am Melissa Garcia. I am a marriage and family therapist. And in addition to talk therapy, I do a lot of somatic therapy. So I pay a lot of attention to the body and how our bodies tell us what's wrong and often communicate with us in ways that our minds are unable to at times. So that's a lot of how I approach therapy with my clients.
Okay. And how did you become a therapist? Like, what brought you to this field, when you were a wee baby?
I've always known that I wanted to be a therapist. Somewhere in high school, I kind of had found my interest in psychology, and started taking classes then and through college. And I don't know, it just kind of seemed like a calling, like something that I really wanted to do. I always enjoyed sitting with my friends and talking with my friends, and I was always the one that people would always come to and talk to when they just needed someone to talk to and ask for advice. So it just seemed like a really comfortable thing to do. So it was something I was just drawn to. I don't know how I came to it. It was just kind of always there for me.
So it was sort of like your calling, like it was meant to be. Okay. Mm-hmm. And what's the first thing you look for in the beginning of a session with a new client, let's say?
The first thing I do when someone new comes to see me, the first thing I do is I try to just be comfortable and just be myself with the person so that they feel comfortable, because that's one of the most important things about choosing a therapist and coming to therapy is feeling really comfortable with the person that you're working with. It's probably the most important thing when you are looking for a therapist, is to that comfort level that you're going to be able to share things, that you're not going to feel scared to talk about some of the scary things that happen, because most people that come to therapy, there's something scary in there that that we all need to share, and sometimes it's difficult to share in other places. So it really depends on the person who walks into my office. Each person I approach differently. I kind of assess just who they are and their own ways of being, their own energy levels, and I try to meet them where they are and not push too much, or those that need a little bit of extra push, I push those as well. So I just kind of read the person who I'm with and go with it from there.
Okay. How do you define your success with a client? Like, what determines that you see that you're making progress with someone?
So when I'm working with someone, I can tell when there's progress when they come in and they tell a story, and they're setting more boundaries for themselves, or they're reaching a personal goal, and sometimes they don't even realize that they are making progress in their own therapy through the process, because it's something that happens real gradual. It's not something that you can make happen. Through the process, you just start changing the way you interact with people. You start getting different reactions from people, and that's a lot of the ways. And then that I notice when people are being successful in therapy. And I help clients to realize that. I help clients realize when they are doing well in their own lives, when they have made a goal or when they are doing something different, and helping them realize that they are functioning better in their lives than they were before.
Okay. So one last question, and it'll be a personal one. So tell us something about yourself that may be different from other therapists, or
Okay. So as a therapist, I went to a very unique school. I went to the Institute of Transpersonal Psychology in the Bay Area. It is, unfortunately, it's no longer under that name, and they've changed their program quite a bit. But it was a very different kind of a program. When I was looking around for different schools, every school I looked at had the same curriculum. They had the same exact classes. But this school offered different things, with dream analysis and psychodrama, body psychotherapies. And so I was really drawn to that. And so I got a really full education about incorporating the whole person into the therapy, beyond just talking back and forth and using the cognitive behavioral constructs. It's more that's where I learned to read body clues and help people tap into where they are holding their stress or they're holding their pain. And I had some really amazing experiences through that. Doing a lot of personal work myself using these modalities was just a fascinating and beautiful experience that when I went from the classroom into the therapy room with my clients, I'm able to just sit and be with them and kind of connect on a real emotional level, on a different level through that, by listening to and tapping into my own intuition, into my own way of being.
Well, great. So it's been successful for you.
Oh yeah.
Okay.
Oh, yeah.
Well,
It was a great education.
Thanks, Melissa. And that's it.
Okay.
Thank you.